understanding like how they get damaged and how to repair them became a little bit of a mission, right? And so that's kind of how I ended up at the mitochondria. And so what ends up happening is that the cell, so at the cellular level, there's actually this discovery. It's like an aha moment when you understand that, oh, this is what mold toxins do. Oh, this is what COVID did. This is where Lyme goes in. And so they go into the cell and they damage the functioning of the mitochondria. So you can't make energy. Today's guest is Dr. Susan Blum. She is the founder and director of the Blum Center for Health in Rye Brook, New York, where she leads a multidisciplinary team offering functional and integrative medicine services. For over 20 years, she has been on the senior teaching faculty for the Center of Mind-Body Medicine, guiding trauma programs globally. She serves as an assistant clinical professor at the Ithacan School of Medicine at Mount Sinai and is board certified in preventative medicine, functional medicine, and integrative medicine. Dr. Blum has helped treat and prevent chronic diseases and is an advisor to the Institute for Integrative Nutrition. She's authored the best-selling books, The Immune System Recovery Plan and Healing Arthritis, where she shares her integrative approaches to treating autoimmune and arthritis conditions. Welcome, Dr. Blum. I'm very excited to have you. All right, everybody, welcome back to Take Back Your Health with Dr. Amy Myers. Today's guest is Dr. Susan Blum, whom I have known for many a year, and we were just catching up, and I am so excited about the topic that we're going to talk about today, mitochondria, trauma, functional medicine. We're going to be diving deep, figuring out, symptoms and how to get you guys well. So welcome, Susan. I'm so excited to have you here.
Thank you, Amy. It's so great to see you. And I think you and I could have chatted for a long time before even allowing everyone to join us, but it's nice for everyone to join us too.
Yes. All right. Well, I always like to start with, people's backgrounds, just so our guest listeners can, or how our listeners can really understand who our guest is and their background. I know you're trained as an MD and ultimately went into functional medicine, but do you mind sharing your journey for us?
I don't mind at all. So let's see. So I'm a physician. I'm sort of classically trained in internal medicine. And right about, as I was going through medical school and doing my residency and all my training, I just didn't feel like it was it. And I always had this feeling like I wanted to understand how to help people prevent what all those people that were in the hospital. And so I ended up going into preventive medicine, and that's sort of my conventional background. But preventive medicine in the traditional sense really doesn't do much prevention. And so I kept, because it's really lifestyle medicine. And where is the best place to look for lifestyle medicine is really functional medicine, because it's really looking upstream at all the factors that help you understand how someone got where they are, right? And then gives you the places to go and look to reverse whatever's going on, find those triggers and treat them. And so I discovered functional medicine back when you did. We were back in those early 2001 or so when we did our initial trainings. And I also at the same time was very involved with the Center for Mind-Body Medicine right around the same time. And I've stayed involved with them as well. And so I've traveled and traveled with that organization and, worked with, it's a wonderful group. Jim Gordon is the founder, but we work with traumatized populations and help train health professionals how to work with trauma and stress and work with themselves to help, sort of improve not only mind and spirit, but also body, right? Mm-hmm. And that's sort of the interface. So thus, as our conversation sort of weaves today, and we're talking about functional medicine and like mitochondria, perhaps, where we can end up, I love weaving in the emotional and spiritual and the trauma piece, because there's this interface, which has really come, as we were saying before, so much to the forefront now. So many of us that have been out here doing this for a while, we're sort of coming to this place of recognizing the importance of trauma and stress. And it's not just us. I mean, it's out there. I mean, the ACEs studies, the average child defense studies. I mean, this is not just us, but I think it's all sort of coming together and giving us tools to really help people.
Right. And I mean, I think,
since COVID, there's a war going on.
Right.
There's a lot of trauma surrounding the election. These are just big worldly things when this not even taking on our own individual personal traumas. And then, you've been in practice for so long. I was in practice and for a long time. And I'm sure you've just kind of reached a plateau with certain people where all those tools in our toolbox that we talk about in functional medicine get many people very far, but then you have this certain population. And so it seems like it's just really coming to a head right now in society. And which I think is what, in one way, I guess, a little terrible that we have so much trauma in the world, but in another way, at least that there are people like yourself, that are here to acknowledge that it really is. What's her name that wrote the book, The Body Keeps Score?
Yeah, The Body Keeps the Score I
was thinking it was a woman.
Oh, no, it's he's a guy.
Okay. Well, anyway, I was just in a
Vander somebody, but yes.
Well, I read that book many years ago. I don't remember when it was published, but many years ago. And it's still, I'll go in. I was just in a small Barnes & Noble the other day where, they have to pick and choose what books they have. And there was a copy just, facing
still
straight
there.
at me, still
I
there.
know.
So, he's been talking about this for a long time.
Right. And not just, and stress and trauma, definitely, but and I think you've discovered this as well. And all the people you've been talking to, people are just sicker, than they were. Like when we first sort of cut our teeth 20 years ago, when you work on the gut microbiome, which we were doing before it became like a thing, right? And
yes, right.
Became a thing. And so we're doing like elimination diets and food and anti-inflammatory diets and different kind of therapeutic diets. And we're talking about stress and looking at adrenals, and we're talking about hormones and looking at the thyroid in a different way. Like we've got all our things we've been doing, right? And then we're looking at detoxification and just general. Like I'll call that like detox light, what we were doing back then. Because now I think not only is there's recent studies about the stress of raising children and how this generation is completely overwhelmed. The teenagers and the kids have anxiety and stress through the levels and mental health issues. And that's coming out of COVID too. But like the families, and not the parents and the kids, like everybody is under so much stress. It's different than it was 20 years ago in that way. And then we have the environment and we have climate change and all the mold from all the water everywhere, right? And so...
And Wi-Fi,
Wi-Fi.
Just we had half our lives at least not having many of these things, right? And now the generation that's having children didn't have half their life. They've had this stuff. And now their kids are, I can speak to it. I have a small child, I do what I can to shield her, and have her sleep without the Wi-Fi and things like that to get a break. But, they're just, the generations to come are not having whole or part or 3/4 of their life not being exposed to all of this.
Don't you think sometimes that we're just doing this grand experiment, on humans?
We're not doing the experiment, but I do believe we are receiving the experiment.
We are receiving this like experiment, and we're guinea pigs in this experiment of a more toxic world. Like you said, EMF, the whole electromagnetics, our air, our water, nothing's clean. Our food supply has changed. And humans are just, I think we just have an epidemic now with people who are just really, really sick.
Yes.
And so the basics, as we'll call them, like food, stress, gut, detox, and in general, that's the foundation. Because as you know, you wrote an immune book like I did, it's the foundation of a healthy immune system. Like you need those things to be working. But, it's almost is not enough anymore, right? Because you do those things and it helps a lot of people, with mild symptoms or just want to get it, feel a little bit better, or they have some mild imbalances or some health issues. It's beautiful. But a lot of people, it's just not enough anymore.
Right. So, well, let's dive into this piece about trauma, because I feel like it is separate from stress, right? Trauma can cause stress and stress can cause trauma. But it seems like trauma, or at least a certain level of trauma, really is in a category of its own. And I don't know if you agree with that. And if so, do you have, a working definition for each of those that people could,
Well, what I've learned from working with so many traumatized people through the center as well as in my office, because it's a conversation that I invite with everybody, is that so trauma is a spectrum, right? And just sort of like stress, where you can't. There are stressors and there are traumatic events, and then there's how the person sort of how it lands, right?
Mhm.
And the magnitude of their response and the magnitude of their sort of how their body takes it in and holds it or not, what support system they have, like where that ends up and how much sort of imbalance it causes in the body or how it's held is really a magnitude. And then it's a culmination of a lot of things, right? Which is, who do you have to talk to? Do you have a support system? Were you healthy to begin with? Was it a last straw event, right? And so I think that, and what I learned early on is that, we really resist the idea of comparative trauma. I remember being in a mind-body group with, this is after Katrina, we went down to New Orleans. And I mean, I had a group of women in my circle, and there was one woman who, she was a nurse who was had to decide who was going to be taken out of the hospital. And another one had been, it talked about having a date rape when she was, younger. And then another one had incest in her family. Like, we went around the circle, and I remember the woman who was date raped. She said, "I feel so bad, like talking about my trauma when yours was so much worse." And so I think it's really important that people don't get into this thing, right, where you compare, because like something that seems not big to you, if you compare yourself, but it might have landed for you and it's so important in your life. So I think it's really important that any I would kind of say like any extremely stressful event, something that's so acutely stressful that it goes beyond your nervous system's ability to manage it, where you continue to have sort of memories and flashbacks that when you remember the event, it still hijacks your nervous system and causes the palpitations and whatever, or, you have the same response that you did when it first happened, or it's persistent and it's interfering with your life, then it's important to understand this is affecting your body, right? And it's time to like work with to get help, moving it, as we were talking before about the importance of moving trauma, right? When you experience it. So I don't know if that answered your question, but it's hard to, there's a spectrum.
Right. Yeah. And then you've been working, with people with Katrina. I know that, Dr. Gordon goes into war zones, right? Children in war zones. I mean,
yeah, so I haven't gone with them, but I went to Haiti after the hurricane, and I've done a lot of my trainings with them, as I worked with just health professionals for regular training programs around the country. But more than that, I think I would take it back into my own. I mean, look, the nice thing about I have my day job, and then I just take a week off and I go and I work with the center, sort of like, how you might join, a group that's going to do really good work somewhere, but you still have your day job. I think it's the lessons I've learned working there is what I bring back into my medical practice, right? Because it ends up at, once you open your eyes and you become aware of how trauma can take hold in the body and cause disease, you see it everywhere, right? You start asking the questions and you start noticing it, everywhere.
And what about for those people? My guess is because of all of your experience in this, that you probably at some level can see it in people and in your patients. I know, a certain level of intuition. I had that in my practice of just, that gut feeling of, asking the questions and whatnot. But what about, the folks that you kept saying, the folks that, have this event and that they've remembered it? What about all the folks that don't remember it? How can we support them in gently accessing this information? What if someone has repressed it so much that they're frankly unaware of it? Which I understand is common.
Well, very common. But do you mean that they don't even acknowledge that there is any trauma, or they think there's something, but they just don't want to talk about it?
right?
I mean, again, this is a little bit outside of my area in terms of on, a personal level, but I've heard of stories of people who maybe have had, incest or sexual abuse, and they were maybe so young that they have repressed it, that they're not aware of it. Or maybe at some level, they're always aware of it. Maybe they've always had that constant anxiety, but they just don't know what it comes from, or they're afraid in certain situations to be alone with people or in the dark, but they can't verbalize that they know that something specific happened to them.
So I guess what I would say is that the first is always so a trained facilitator who can hold the space and be able to create a safe place for somebody to access their memories, I think is really important. So it'll be hard to access those things unless they're in a place where they feel safe. And so a lot of times for me, I'm not necessarily the one who's going to really, I'll refer them to someone, right? My role really, and I think our role as the initial sort of clinician, it's really just, it's making the connection and inviting the question. So do you think that, and I also, we're talking about incest and like big things here, and I brought up big things. Sometimes it's not that big.
Yeah, right.
It's something that was really bad. Like they were terrorized by their older brother, right? And there were guns in the house and like one went off one. I mean, I don't know. I'm making up stuff, like sometimes it's something that just was terrifying for them, or they just felt unsafe. When you look at the ACEs, the adverse childhood events, it could be an alcoholic in the house, somebody, and which is one of the ACEs, and you can score it and you can see, and children that have higher ACEs are more likely to have chronic disease or an inflammatory and autoimmune or chronic illness when they're older, metabolic, especially like diabetes. And so it's really a big field of study, understanding. And these things are traumatic in their way, right? Yeah. So I think it's inviting the conversation, and just even going through like, what was it like growing up? Was anything acutely stressful or intensely stressful? Some people don't like the word trauma. Right? Did anything happen? Is there anything you can think of why you started getting stomach aches when you were in high school? And so it's inviting the conversation. And if I make that connection, then I will refer them, right? Because I'm not a therapist. Of course. I'm a trained physician, but I feel comfortable sort of helping them make the connection. And then I have a network of different therapists that I can help, refer them to get and open up that opportunity for them to be willing to look. So what you can do, Amy, is have them be willing to look. And I do just want to finally, add the last piece, because what I heard in your question is there danger in like opening this thing, right? Will it be upsetting for them or hard, or like to open this Pandora's box for somebody? And it could be. Right. But in a safe place with a trained therapist or a trained person that could facilitate that, they know how to handle it, So I think, that's why as soon as you sense something or if somebody feels they might have something there, that it's good to find the right person to help them.
Right. And so when we talk about this trauma, mind-body connection, what do you think it really is? Or when the author was writing about, the body keeping the score and storing this in various places, do you think that there's something truly physiologic going on?
100%. And I think that in the simple answer, which I think you sort of led me to, but too. I mean, in the early days, we just always thought about it. Okay, stress and the adrenals, right? And so, there's definitely ends up a loss of resiliency in the whole stress system, right? Which is the autonomic nervous system, which is the part of the nervous system, right? So the adrenals are involved with the autonomics, which is fight or flight. And by the way, people can respond with a fight or flight, but they can also respond with freeze, which is the parasympathetic. They get stuck in parasympathetic, right? So you can get stuck in parasympathetic, which is more freeze. Like something happens and you run and you freeze, or something happens and you fight. But those are all stress responses. And so the acute stress response is a well-known sort of physiologic thing. So we know that stressors come in, trauma comes in, and you can end up with an on switch or you can end up on the brakes. But either way, you don't want to get stuck in one or the other, right? So if you get stuck in the on switch, that is the sympathetic nervous system, and you lose that resiliency, right? And so over time, those hormones and those neurotransmitters can damage the body if they're like being pumped out for too long over a long time. And so that's one definite way, right? So that's sort of the classic, stress response. And by the way, like those hormones, like cortisol, which is one of the hormones that's released, cortisol interferes when you have chronic, like high levels of cortisol pumping out. Cortisol interferes with your thyroid hormones. It blocks the binding of thyroid hormones to their receptors, so they don't work. It affects your sex hormones. So like your whole endocrine orchestra gets completely thrown off. The women experience crazy periods, and like really it affects your whole endocrine system. So that's one way for sure. We know that stress and trauma damages the gut microbiome. And so we know that, and the gut immune, right? So 70% of your immune system is in the gut. So we know that you end up with damage to the microbiome, which can, there's a whole list of issues that people can end up with, which can promote chronic inflammatory diseases if the microbiome doesn't repair with leaky gut and all that. And so stress ends up there too. It ends up influencing the immune system in a very important way and can promote autoimmunity. So there's all those ways. And then these are all things, but those are things that we've been working on for a long time, right? Those are classic functional medicine stuff. And so what I've been pondering lately really is, okay, so you work with someone to help them, with their food and stress, and you talk about trauma and you balance, separate from like the body keeps the score in the long term, where does it end up? Like, depending on genetics, I'll just speak to that for a second. Depending on genetics, I think I don't know what disease somebody will get, right? So where you end up with the damage in your body, I think is probably follow some path that's related to your predispositions. And so one person can end up with cardiovascular or diabetes, and another person can end up with, inflammatory bowel disease, and another person can end up with rheumatoid arthritis. Like, I don't know, right? And so, so there's that part. And so I can pause there.
Okay. Well, I know, that I don't know if you've come up with this, but certainly that you wanted to talk about, mitochondria and their role, sort of the mitochondrial cell danger response and the healing cycle. And this isn't something that I've heard of. So I don't know if this is something that you're learning about, or if this is something that you've sort of in your own clinic, started to ponder, is this a new theory? Is this something that is actually happening? So could you tell us about that? Because I'd really not thought about, the mitochondria being, in the trauma cycle.
Well, I actually entered in, the connection between, when I was reading there's a guy named Naveau who did all this research on the cell danger response, which is sort of what happens when the cell senses danger. And the really interesting thing was when I was reading, is that it says danger can be real or perceived. Right. And so perceived is stress, right? And trauma. And they talk about the connection between how trauma can land and cause the cell to enter the cell danger response. And so I thought that was fascinating. I'll come back to that connection in a minute, because I want to back up for a second and just talk about sort of what the mitochondria are and what they do.
Yes, please. Thank you.
Yeah, and just sort of make our way there.
Okay,
right?
Sounds great.
Because when we were talking before about why is everyone so sick, and this is actually, it's not just that I ended up here. I think this is kind of what's happened because of COVID. Because from long COVID, there's been a lot of discussion about the mitochondria. Because infectious diseases, where does like mold and overwhelming environmental toxins and infectious diseases, where do they do their damage and cause like long fatigue and brain fog, and like loss of function? And it's because they're damaging the mitochondria. And so in our effort to try, and in my effort, in my team's effort to try to figure out how to help people recover from COVID, I think that's kind of how I ended up digging into, and all the mold people that are showing up.
Right.
And I know you know about that. And that's been for a while, but it's now that, it's again, one of those things, you're a hammer, everything's a nail. So now we test everyone for mold and we find it all over the place, because now we know it's such a big thing and it's so pervasive, right? And we test everyone for Lyme, and like, we're just looking for these things and we find them. And so what I discovered was really digging into the mitochondria in terms of understanding what they are, which are, they're the little furnace inside every cell that makes your energy. And energy is this thing called ATP. And so we'll just use that word. I just wanted to put it out there in case I refer back to it. But it's really basically it's the little furnace inside your cell. And cells have like hundreds of thousands of mitochondria, and it depends on which cell, so which organs. So muscle cells, because they need a lot of energy, have more than your nervous. Well, the brain has also, right? Quite a lot, right? The brain, the muscle cells, your heart, because it's beating all the time, they have the most dense mitochondria. And so understanding like how they get damaged and how to repair them became a little bit of a mission, right? And so that's kind of how I ended up at the mitochondria. And so what ends up happening is that the cell, so at the cellular level, there's actually this discovery. It's like an aha moment when you understand that, oh, this is what mold toxins do. Oh, this is what COVID did. This is where Lyme goes in. And so they go into the cell and they damage the functioning of the mitochondria. So you can't make energy. And there's this process called the cell danger response. And I'm keeping it very simple. You have there's 4 stages of a mitochondria. There's the healthy, happy mitochondria. And then there's CDR1, 2, and 3. And cell danger, it's the healing cycle. So the cell gets like alarmed. Something's happened, whether it's perceived or real, right? So there's this alarm and the cell goes offline. It disconnects from all of its community. It's like, because the cell will have to talk to each other and work together. Think about your liver doing its detox. Like all the liver cells are part of a family, right? Community. So the cell goes offline and it tries to like heal itself. And it's like damage control. There's some inflammation. There's all sorts of cytokines and things that are released, But if the danger goes away, like if the toxin passes or you heal from that, you heal from that illness or whatever, you're going to move through the healing cycle and the cell will recover. And so after sort of the damage control, but during this stage, the cell releases all its ATP, like it stops making energy and it releases it into the extracellular space, we call it, which I find really interesting because the other big thing we're always treating is mast cell activation. And it turns out mast cells have tons of ATP receptors. And so when the cell goes into CDR1 and releases the ATP, it activates all of these mast cells. And so things are so connected, right? And so, which is kind of really interesting. And so
can we just pause there for a quick second? Because, I hadn't really thought of that. And so, people who are getting at least conventionally treated for mast cell are getting, all of these things to shut down histamine and whatnot, but they're not actually getting something to help them, reboot or, rejuvenate or recover their mitochondria. I mean, I hadn't really thought about it as being a mitochondrial disease.
If you read the articles from Naval and this whole group that's been like working on this, they feel MCAS is a mitochondria. They think everything's a mitochondria disease, by the way, but they make the connection to mast cell activation. And I don't think anything's one thing necessarily, but I think that when you think about mast cell, the triggers for like how do we treat mast cell? You do all this antihistamine stuff, but like you have to treat the triggers, right? Because they got there, something's poking them. And so what is it that's poking them? It's the same stuff that's damaging the mitochondria. It's infections, toxins, mold, that kind of thing. And so, which has been like really poking their system to be this reactive, and it damages the mast cells. And so, but it's also damaging the mitochondria. So there is this connection between the mitochondria and the immune system in that way. And so, which is why as soon as there's this, the cell danger response happens, that's just the reaction to all these environmental insults, whether it's trauma or it's physical in the air, water, whatever you're breathing or being exposed to. And if the number one most important thing is to clean up, get rid of the offending trigger. In order for someone to heal, in order for the mitochondria to recover, you have to clean up the environment. It's the most important thing. And so they need help. They need someone to guide them through cleaning up their environment, testing, figure out the triggers, clean up the mold, do the remediation, and then the cell, and then we help the cell, which we'll talk about in a second, like come through the healing cycle, but just removing the triggers and getting really good restorative sleep, which is when your mitochondria heal, which is the deep sleep part of restorative sleep, the mitochondria will heal and it'll start moving through the cycle. And so the next stage of the cell danger response is the mitochondria start repairing themselves, the cell, and they replicate. And they increase their biomass, and they come back, and they start getting, healed. And then in CDR3, they hook up into their neighbors, and they start functioning as an organ again. And then they come back, and it's sort of like the new mitochondria have to be trained and fully differentiated. They start out like a little undifferentiated because we replicate mitochondria. And so the part of the healing is biogenesis, which is the replication, and then they have to be trained and be brought back online. So it's this whole really interesting healing cycle. And so in order to give the cells a chance to do that, that's where all that like trauma work and clean your environment and get a good night's sleep and, but removing the danger, is the most, and then providing the environment to help them heal. And there's definitely sort of supplements and things we can talk about in terms of like how to help and like the kind of nutrients the cell needs for recovery. But I think that that's the most important thing. And when I keep going like this, because it's like this cycle, right? And so, and I talk with my hands, as you see. And so, but I think it's so fascinating to like know and to understand, so there's a here it is. Like, here's the place where that toxin made me sick, and there's actually some studies out there that looked at like where gliotoxin has an effect and where, like, when you look at, so in the mitochondria, then there's these enzyme complexes, and it's called like enzyme complexes 1, 2, 3, and 4. And that's how the body makes the cell and the mitochondria make energy. And so that's how ATP is made. It just sort of moves through this chain. And different toxins and different mold toxins damage different stages there, which is really interesting.
And wouldn't it be nice, I don't think we've come a long way since I retired clinically to test the mitochondria. I mean, has anything really come out? Or are you more testing for the infections, for the mold, for, these various things? And if you see it, you're making an assumption that there's some mitochondrial damage associated with that.
There's a test called a MitoSwab test. Now, different people have different feelings about it. I will tell you that how well they find it's effective and them, how well they feel it's aligned, the results are aligned with their patient. I've been using it and I'm really liking it.
Okay.
It was used for a long time in the autism in the kids world, in the whole pandas in the autism spectrum world. And that's how I heard about it. And I started using it and I love it. It actually tells you about the biomass. It measures something called citrate synthase, which is that's a reflection of the biomass of the mitochondria. Like, do you have enough of them? Okay. And then it measures complex 1, complex 2, complex 2+3, and complex 4. And it tells you how well each one is functioning. And that's like in the membrane of the mitochondria, these complexes are embedded, and that's how you make ATP as sort of the electrons move through these complexes. And if anything's not functioning enough or well enough, it gives you a percentage of function. So you want it to be over 50%. And obviously if it's 6%, it's like in the toilet.
Right.
Whereas, 40% would be close. And so what happens is you can actually look and see how the enzyme complex, which ones are damaged, or if they're damaged, or if that's why someone's tired. So now as part of like a fatigue workup, or if I suspect mitochondria, we think it was an infection, we concerned about the mitochondria. Now I go ahead and I do the MitoSwab test, and I have found it's really helpful And so, for example, you know how everyone says, go get an NAD drip? Like we do IVs at the office, right? And go get an NAD. And like, I kind of like to know if someone needs something really before I just give it to them. There's a whole long list of things a person could take for their mitochondria. But it turns out that complex 1 is the complex that if it's really low, that person needs NAD. And if it's super low, then an IV would be great. And then you can give them, and if it's only a little low, you can give it oral, right? And so complex 2 and 3, that's for CoQ10 and ubiquinol, the reduced form is better. And so you give them CoQ10. But all along the way, if any of them are low functioning, and by the way, it turns out that you can have a lot. You can have overfunctioning, and especially of the biomass as a reaction to an infection. And when somebody is cranked up and doing it over, then you have a problem with oxidative stress, which is another word that we might need to talk about. But too many free radicals running around that damages the cell. So overfunctioning can be bad too for oxidative stress, which also ends up causing a problem in making energy. So yes, so I'm using MitoSwab. I also do a lot of testing for oxidative stress with other tests, just organic acids, or you can even do it through routine labs, and you can do, the cardiovascular oxidative stress markers just to get some like guidance, like oxidized LDL and myeloperoxidase and things like that. The mitochondria need B vitamins, so that however you like to test people for that, there's micronutrient testing, there's organic acids testing, but I try to like target, and I'm using a lot of liposomal glutathione these days, you know.
And let me ask you real quick, when you get this, I was just looking up the website, when you get a MitoSwab, and it gives you, where the problem is, or what level you are, but do you know in which, I'm sure not as specific or sensitive to tell you which organ system, which mitochondria are having the problem, and it's just a collection of every, okay.
So it's a buccal swab, and along those lines, the cell danger response, actually, you can have different cells in the body at different stages of function, right? So they're not all going through the healing cycle together.
Right. So it's a compilation of all of this, and says this is your percentage and how many, and you don't know if it's 10% within this area or it's 90% within your, say, kidneys.
I would say, exactly. And so I would say that that's definitely a downside for doing it, for like interpreting, but like, it's kind of true about anything. I mean, that's what I was saying. Like, you kind of want to see whether it's aligned with the clinical picture, with what makes sense. I'm only doing the test on people that I suspect, I've been doing so much other work with them to help them treat their fatigue or recover from an illness, or, from a viral illness, or whether it's COVID or something else. We do a lot of Lyme, and and then I'm like, okay, let's just see what's happening with your mitochondria, and I'm finding it's helping me direct my sort of where to focus, are the mitochondria, because I'll see and so, so it's probably not every mitochondria in the body, but if I see complex 2, 3 is really low, or I see complex 1 is, then I'll say, go get NAD, and inevitably they feel better, because not everybody feels good with an NAD drip. And so it's like some way of differentiating. So it's not perfect, but I have started using it, and I'm finding it helpful, as another piece,
right?
To everything else.
And so then you look at, all the things that we need to support our mitochondria in general. And then are there any more what I might call sort of outside the box treatments, hyperbarics, ozone? You've talking about, these various IV drips. Are there other places for people to go get more targeted therapy for their mitochondria? Which ones are you using? Which ones do you find have the most bang for their buck?
Yeah, so I love ozone, especially, so part of it is, why are your mitochondria damaged, right? So you kind of want to treat the root cause. And so just like we said, people would try, you want to help someone find a therapist. You want to, we need to figure out how we want to treat your Lyme. We need to make sure the mold's out of your house. We need to test your water, and, really sort of checking everything. And so Water, and I do a lot of toxin testing and heavy metals testing, really trying to get to the root, clean everything up. And then, especially infectious diseases, if that's the root, then I think ozone is fantastic. So I love ozone. It's a great way to help support the immune system, to help clear out the viruses, which is.
And do you all offer, I know you do various things in your clinic, or do you do IVs and ozone in your clinic?
Yes, exactly. So we've got ozone, which I've been struggling to get. I have all the equipment, and I'm just looking for an ozone therapist. So if somebody's out there and wants to come to New York, so I'm in the middle of trying to find someone. Good luck.
Yeah, and you're
that.
in upstate New York, right? You're in
I'm 45 minutes north of New York City in a beautiful suburb called Westchester County. So I do the home metro area. People come, but working for us, you want to live kind of in north of the city is where we are. Although people take the train and it's not that hard. But hyperbaric oxygen is good for complex but is good. Yes. I do a lot of glutathione IVs. We do mito recovery IVs, and so lipoic acid. So antioxidants are great because the mitochondria is so sensitive. And so glutathione and lipoic acid IVs. So definitely infusions are really good. Like I said, NAD, I try to sort of, help, to differentiate who really needs IV NAD and not just send everyone for that. But
is there a
really
downside to NAD, or are you just more... It may not work?
Well, because it actually, some people, you could feel worse. And people who are listening who might have tried NAD, if you really need it, it's going to be great. You're going to feel good, and you'll feel good, and you'll feel good. But then the moment will come where you're like, nah, not so good anymore. And so I think that if you do NAD and you didn't really need it, that wasn't the part that was damaged, or, then after 1 or 2, you might just not feel great. Or you just say, I get a headache. You just know that it didn't really help you feel better. And so I don't think NAD is an automatic for everyone. But, certainly people can do IV NAD and just do it until they just stop getting the benefit from it. And then they know they don't. So that's also another way to do it, which is perfectly fine because not everyone's going to be tested. But IV NAD is really good for rebooting the mitochondria, especially if you need it. And you can try it and then just decide to stop. It's not so much that you feel terrible from it. You just want to be aware that it really helped, you feel any better like you did the first few times you did it. Right. And so there's that. I think that, I use a lot of LDN in my practice, and that's also just for the immune part,
low dose naltrexone.
Low dose naltrexone. The peptide issues are a little bit tough right now with the whole FDA, and there's no peptides that we're using specifically for mitochondria, but, again, helping oxidative stress and inflammation, sometimes, and just the immune system sometimes helps. But I think, again, and then, and I didn't mention the membrane therapy. So this is where phosphatidylcholine comes in, because the membranes of the mitochondria, these complexes all live in a membrane. And so there's a lot of aggressive people. There's a whole school of thought that the main thing to do is membrane therapy, right? Which is PC, phosphatidylcholine. So we do that too.
Do you do that IV or orally or both?
So we generally do that IV and sort of alternate the regular mito IV with the phosphatidylcholine. And depending on how sick someone is, because I tend to be less aggressive the more sick someone is, and I go really slow in baby steps, because when someone's really sick, sometimes they feel worse if you do too much at once. And that's an important thing. I tend to layer things and start slow and just add things one at a time. And I still believe in the core functional medicine pieces, right? And so I still think that's where most of the work is, and environmental detox, and doing, even just supplements for that, like binders, and, really helping the liver detox. Binders are just, supplements that help grab the toxins in your gut and pull it out, right? And so adding more layered support for detox, just the environmental cleanup in the body, right? So we sort of skip that, but that's a really, not only do you have to remove the triggers, but cleaning up the body and getting the toxins out of the body. And so maybe I would do IV chelation if someone had heavy metals, and so there's really, so we do a lot of testing for toxins and a lot of physical body cleanup. But the sicker someone is, the slower you have to go.
Right.
And I think that's the important piece to keep in mind. And I would advise anyone out there, if you are just that person who's very sick, don't like read a list and then just start taking everything the next day. Like start with one thing at a time and go really slow. And get someone to help guide you, if is always the best course of action if you can,
And so I feel like we covered, if you had COVID and that was a trauma to your body, or if you have Lyme and that's a trauma. But what about, I don't know that we 100% really covered the connection of perhaps a physical or psychological trauma to the body and the interplay with our mitochondria and them, shutting down. I mean, has that mechanism come to light yet? Or is it just a theory at this point?
I think it was in the articles I read, whether or not it's a theory. So what I understand is that that trauma itself, the emotional piece or the intense reaction, however the body's responding, whether it's hormonal or nervous system, and everything's wired to everything, right? It puts this mitochondria into cell danger response. So the mitochondria enters cell danger response from trauma. And so, unrelenting trauma over time could just disable the mitochondria. They just go offline and they need to regenerate and come back. In addition to all the other ways that trauma, affects everyone, like we talked about in terms of the stress response in the body and damaging all the organs. And so, and trauma, again, it's this spectrum. It's like stress, intense stress, acute stress, really over the top stress, and then trauma, right? And so where something is just intensely stressful or acutely intensely stressful, and where something it gets defined as trauma, I think is just a matter of, I don't know. There's probably some definition there where it crosses the line, but I think it's still on a spectrum.
Right. And probably a cyclical, or what came first, the chicken or the egg, in terms of, you have this stress response to a trauma. It, suppresses your immune system. That then allows for the Lyme or the mold or the COVID to come in. You can't recover from that, which then damages your mitochondria even further. So, it being all connected. And then, as you and I were talking before this, recently got connected to Joe Dispenza's work, which is really about, also the mind-body connection, and that, whether you're really in the stressful situation or you're just thinking about the stressful situation, your body's response is one and the same. And your body doesn't know whether you are currently, if you're still, just ruminating over that phone call you had with your sister-in-law, or, that fight you just had with your spouse, your body is perceiving the rumination of going through that event over and over in your head as if it's still just happening now. And that is happening for so many people, right?
So many. And so along those lines, we actually created a whole emotional wellness program at Blum Center. I mean, one of my other doctors, Danielle Greenman, who's an amazing physician, she's really took the lead on creating. We have a ketamine program that we're doing at the office.
Oh, great.
Yeah, because what we're finding is it's not just, ketamine is not just at our center, it's not just the office, but like the ketamine is what sort of this whole idea of psychedelic assisted psychotherapy, or just helping people sort of get out of those ruminations and just sort of get beyond them. It sort of takes people beyond their thinking mind to that place where beyond those thoughts, and it helps sort of discharge them in a way that's really fascinating. I've been completely won over by it. At first I was like, okay, just people who are anxious and stressed, like the usual, just for a lot of our patients, who don't have a diagnosis of anything like a major depressive disorder or an anxiety disorder on medication or anything, but just people where it's really impacting their lives and they would really like to feel better. And they do a bunch of ketamine sessions, 4, 5, 6, and it changes their lives. I mean, it's just really fascinating. And I think that, so in terms of emotional wellness, again, there's that spectrum, right? So we offer these mind-body groups for people to do more self-awareness work. And, that's the model for the Center for Mind-Body Medicine. We offer amino acids. We do the functional medicine mood stuff. We have coaching for stress. We have a health coach who focuses on stress. We have online meditation classes and all that. But like, I think that this sort of moved us to offer that as well. Really sort of, I think it acknowledges what you were just talking about.
And
it acknowledges what's going on.
So you're doing that as IVs?
Yes.
Okay. Because there are various forms, people
We're
know.
We're doing IV ketamine.
And so, yes, the interview, the other podcast I was supposed to do this morning was actually with my own personal EMDR therapist.
Yes.
After I went through mold for yet a third time of building a new house, I had PTSD and went through EMDR with her, which was so helpful. So that will get, rescheduled. And somehow we got on the topic. I've personally never done, ketamine, but I definitely know people who have. And
yes.
I mean, I've given ketamine in the ER to children to suture them and things like that. But somehow we got on the topic that, she has a few patients that she has another doctor prescribing intranasal or troche ketamine. And it really helps open them up even further when they're then doing the EMDR.
In the session, right. And so I have an amazing clinical psychologist friend who has done all that training too. And so the idea of so that's one of the ways a lot of therapists are working. And it's actually where you can do there's all different ways to do ketamine, right? And so you can do the sublingual, you can do the nasal and have your therapy session, right? And so there's psychiatrists who are doing that as well. And then you can it's really important to have someone to talk to afterwards. It's called an integration session. So Dr. Greenman provides the integration at our place, or people go to their therapist. Like we know that people have a therapist, or we provide it. But sometimes we've had that happen at Blum Center, where she will be she'll join them while they're getting their IV. Most often, people have a session, an intravenous session, and then they sort of take notes, or they record, they make sure to sort of write down what their experience was like and what they learned, and take it and process it with someone after the fact. But it's a really interesting whole approach where you can actually have someone processing it in real time while a sort of trained facilitator is in the room, whether it's a therapist or a physician. So I just think it's highlighting the importance of the need is so great, with everything going on. And I really just think it's a wonderful opportunity. It's a wonderful tool.
Yeah, it seems like it, our ego and our mind it's there to protect us from all of these traumatic events. And so, our mind doesn't really want us to access them. I mean, as you said, there can be the mind that's protecting you and not accessing it. And then there can be the mind that is just ruminating and staying in fight or flight over it. And so for those that aren't familiar, I mean, probably most people are, particularly after, Matthew Perry's death, what is ketamine? But
I was just going to say that.
Yeah, it's something that as an ER physician, I used for children instead of having to do anesthesia when we could, when the suturing them, they had a laceration and it was too big or too painful or in an awkward spot. So it's considered what's called a disassociative medicine. And it's very quick on and quick off with the IV. I don't know if there's anything else that you want to say about it, Susan.
Well, I think the only additional thing that I would say about it, which is why it's so great as opposed to like psilocybin or there's no tripping, right? Mm-hmm. I've sat in the room and with people, I've gotten to observe it, and it's also about dosing. So most people don't disassociate. You have to go to really high doses to disassociate. I mean, you sort of you disconnect from your thoughts, right? And most people's experience is it's like they're in this deep meditation space of quiet behind their thoughts without needing to meditate almost. But the nice thing about ketamine is that if somebody's having an experience, and we haven't even had to do this, but you turn the drip off, in 20 minutes, they're out. It's completely out of their system. They wake up, you feel like yourself again. So if you were ever worried about trying something, as opposed to psilocybin, which is hours and hours to get it through your system, right? And so there's no such thing really as having a bad trip, even though I wouldn't even call this a trip. It's from what I've experienced in the way that we're using it for sure. So I guess it's very reassuring to me to know you can just turn the drip off and it's over.
Yeah. Yeah.
Right. And I think that's very reassuring for most people, and it's dose related. So you can start at a low dose and you don't even have to go up to those really high doses. And most people, the way you disassociate. I think Matthew Perry gave it a bad rap and made everyone sort of afraid that it's an addictive. But he was using it like a drug from a drug dealer almost, right?
Well, he was. I mean, that's the whole story is they were literally going to drug dealers.
So all these things, if you're an addict, all these things can be abused. But for the everyday person who's just struggling with trauma, and so we're so happy to have a tool that we can offer our patients as we discover and unearth sort of these traumas. And it's amazing for trauma. It really is. But it's really important, like you were saying before, that somebody has a place to land. They have someone to talk to about it, that there's a place to process it. You wouldn't want to sort of unearth new things without having someone to talk to. And
that's probably my understanding is the biggest thing, because there are all these ketamine, clinics popping up all over the place. So I think you certainly can dive into this more specifically than me, but, interviewing, make sure that there is somebody there that's going to be integrating with you if you're going to that clinic. I mean, and even if you have your own therapist, I mean, I think it's probably important because they're there, they're at that center, and then, meeting that person and making sure that you feel comfortable with the person that you're going to be, integrating with afterwards.
Exactly. And that you have trained people there to be with you and to help you through anything that might come up, because you don't know, what you might remember. And like from our experience, I mean, things that people remember tend to not knock them over. Like they're memories, but they come sort of more smoothly than, if there's something that people remember, they don't tend to be knock them over in a way that causes distress. But I guess that's always possible, which is why you want to have somebody who can catch them. Right.
Yeah. Is there?
Go ahead. In general, right? We want to be able to take care of people if they show up or put themselves in our hands. Any IV, anything that they're doing.
Right. Is there any, in talking about all of this, any success stories or a patient that, sticks out in your mind, or even, your own personal experience? If you're like me, I was always a guinea pig trying, everything on myself in my own clinic. Just anything you want to share regarding, trauma, mitochondria?
I don't think so. I mean, not really. I mean, I just really wanted to make the connection between everything.
Okay.
Yeah. I kind of wanted to highlight sort of what I really just wanted to highlight was to acknowledge for people listening that yes, people are sicker. Yes, we need to know where to go next. And there's a lot of really good research. We now know how trauma lands. That's the place to go next. Your stress and your trauma, and to address that and figure out, what it means for you, how it's influencing your health, how it's landing in your body. And also for all the infections and toxins. And it's sort of the two parallel things, in a way. They're different, they connect, but they really are the two big, I think, upstream places to go, to help, people understand, to help the next place to go. And I think it's important for people to know there is a next place to go. There's always the next thing to look for. And I think we're learning. And I just, for me, like the next big frontier in medicine, I think is infectious diseases and viruses. It's just unbelievable that we don't know how to treat them still. And so there's still a long way to go, for even for the repairing work that people need to have done. And I feel like we're just at the beginning of it all,
Yeah, I think one of the things, and I think we might have glossed over it, is we're talking about, the people who've already gotten sick and the people who already, have had the trauma. But in terms of prevention, I think we both write about this, in our book. But for those of you who are listening who are not sick yet, maybe could you quickly talk through some, preventative measures with our mitochondria and these infections?
Oh my God, 100%. And so here's the thing about your lovely mitochondria. They're just sensitive. And this is true for prevention of all chronic illness. You have to clean up your environment. I think cleaning up your home, your work, your food, your air, getting the toxins out of your food, getting the clean, filtering your water, making sure that you don't have mold in your house, because those things will, if you're not sick now, they will eventually make you sick. And so I think all the measures to make sure your environment's cleaned up and to eat a food plan that gives you so many antioxidants and so much fiber, because and however you want to do that, there's all different food plans out there, but like no matter how much animal you want to eat, and I'm not against eating animal, you have to eat a lot of vegetables, right? Which give you all the color. And so the liver and your body's detox, and through the gut, your microbiome so it's a liver-loving, gut-loving food plan, right? So a lot of plants, a lot of fiber pulls toxins out, antioxidants help, sort of mitigate all the free radicals from the toxins and helps the liver do a good job. And so I think, so clean up your environment, make sure you're eating food that supports your gut microbiome and your liver, and your detox process, because we live in a toxic environment. And so you always want to be doing that. And then, and then stress, practice, find a way to keep balance in your life. Make sure you're sleeping, your mitochondria repair at night, because the mitochondria need those antioxidants. So the mitochondria are healthy if you don't have toxins, and the mitochondria are healthy if your immune system is robust and clears the virus out when you get sick, and your mitochondria are healthy if you have enough antioxidants, because it's like a little engine and they make sparks, and you always have to be putting them out with antioxidants. And so, a good healthy lifestyle, which is what we talk about day in, day out, and we've been talking about for 20 years, all those things really still apply. And especially if you're generally healthy, you keep doing all those things, you're going to be good. Mm-hmm. And hopefully you'll just stay that way. But really, clean home. As you know, and as I know,
right?
And my own toxin-related stuff happened to me too, which is a talk for another day,
right?
But we learn the hard way, But stress and address the trauma. Talk to someone, unearth it, process it, get it out. Find ways to bring balance to your life. These things will eventually make you sick if you don't, do them. So that's not a lifestyle, 101, which is really, it's home base for anyone who is sick. And for prevention, you're good, if you can do those things, but a lot of times until people get sick, they don't really go start looking, for the mold, or they don't go, oh, I had a leak, whatever, when you feel weird. But if you had a leak in your house, you got to better make sure you opened up all those walls or ceilings and like nothing's festering in there. Right.
Make sure it dries out. Absolutely.
And make sure it dries out. Yeah. So,
well, before we part ways, I like to always ask my guests 3 ways that they would encourage our listeners to take back their health.
So 3 ways I would encourage you to take back your health is create space in your day every day for yourself.
Good one.
Make sure your life isn't just busy, busy, busy. So whatever that means to you, that could be journaling, that could be going for a walk. This is about balance. So create space for yourself every day. Pick one way that you can sort of know yourself better, because your intuition will always tell you what the best next step is for you, for your health. So find a way to always be able to check in with yourself. And you'll always have a place to get a way to get those answers. And, what pops into my head is be with your friends, social.
Okay.
Social
community.
Yeah. Community.
Yeah.
Go back to community. The isolation from COVID was really bad. And so I think for a lot of people, and I think we all have to find a way back to community. and with community, there's support. And don't watch the news all the time.
Oof, I would say don't watch the news at all.
Don't watch the news at all, right? So the news, don't let the news get you. But you see, like, if you know yourself and you have time every day to check in with yourself and ask those questions, you'll always know what to do about your food, and you'll know what your body needs, and you'll know, So I'll add sleep to that. A good night's sleep and checking in with yourself. I think that's and trust. Trust that you'll know the information you want to follow when you read stuff online. So,
yeah. And where can people find you? Social media, your clinic, your center?
Yeah, so gosh, I didn't even prepare any of that stuff. So the easiest thing is blumcenterforhealth.com is my clinic.
And Blum is BLUM, and we'll put that in the notes.
Yeah. blumcenterforhealth.com, and that's the best way to find us there. My online programs are on a different website, but you can find that through Blum, the one place. Just you can go to the one place. That's where my book stuff is, on Blum Health MD, which is a different platform, but just to make things confusing. But Blum Center for Health is good. All of my social media stuff is on there too. So just going to my website, I think, is the easiest place to go.
All right. Well, thank you so much.
Thank you. It was great being here.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.